guys, Dr. Varun Acharya here, your dental review guy, and today let's talk about a problem which we are facing in this current pandemic. Most healthcare workers are using N95 masks when it comes to their aerosol generating procedures, and what's happening is they usually come with these elastics on the side. So when you put this on and you hook it on here, you can see, and you adapt the bridge of the nose of course, but you can see there's a lot of pressure on the ear. So I've had a lot of complaints from the people who work in my office and a couple of friends, physicians, dentists, everybody complaining that this is quite a painful experience. Because remember, these masks are typically designed for maybe painting or asbestos removal or any kind of hazardous application, not really designed for long use. So I started looking online to see if there are any other solutions available to kind of mitigate this issue and make it less of a problem. So one of the things that came up, and you guys can find this too online, are these 3D printed designs. So if you Google for an ear guard, you should be able to find something like this, but there are a couple of problems with this. So for example, if you want to print this and you have a big enough printing bed, this would take only about 12 to 15 minutes. But the problem is the 3D printer I have does not have a large enough printing bed. And what ends up happening, so if this was my printing bed, I need to angulate this quite a lot to make sure that I can print the whole structure. And now what would have been a 15-minute print if I had a large enough bed has now become a 5-hour print, because 3D printing takes longer the more vertically tall your object is. So to print 3 of these, it took 5 hours. So that becomes expensive because a lot of material is being used, and you really can't mass produce something like that. And the second very big problem with this is it can break, and it breaks pretty easily. So this is not really something which is very durable for long-term use. I'm still going to show you how it works. You would take this, you would hook on one end of your mask over there, put your mask on, fold it over the back, and that's it. So now you see that your ears are not being, there's no pressure on your ears at all, and you can adjust it a little bit however you like. And you can see that the ear guard sits on top of the head and does not, you can also actually put it here. There are a couple of designs where people have put it at the nape of the neck, and that seems to work for some people. It really depends. So after a lot of trial and error, we decided that maybe the best option would not to be to 3D print these objects because it's expensive and time consuming. And instead we cut it out of plastic. So if you take a look at this, this is a very simple, very, very flexible, and most importantly, easy to disinfect, and it works exactly the same way. You would hook it on over here, you would place your mask, and there you go. So no pressure on the ears anymore, and you can use this for long hours and it's not going to be a challenge. So I want to get this to physicians and dentists across Chennai as soon as possible. So if you live in Chennai, I would like you to stop by my office and I can give you these at no charge at all. I have to limit this to 2 per person just so that I can make sure that everyone gets this with the inventory I have. We've done about 1,000 so far. For the rest of India, I am working on a way to try and get this to you. The primary challenge is really the shipping. So watch out for a link so that you can purchase these and have them shipped to you wherever you may be in India. So till the next time we meet, keep your ears safe and keep that smile on your face. This is the Dental Review Guy signing off with a smile.